Hi, and welcome to the Vet Dental Show. I'm Brett Beckman. I'm a board certified veterinary dentist. And we bring this show to you every Wednesday, the general practitioner and the technician, to help you and your dentistry team become even better at veterinary dentistry. And today we are so pleased and honored to have Trudi Bowden. Part one of the podcast with Dr. Trudi Bowden was amazing. If you have not listened to that, go back and listen to the previous episode. Now we will resume with episode 2 with Dr. Trudi Bowden. Back up a little bit because this becomes important to the structure of practices that are not quite where you are yet, but are getting there. And one of the things that I remember that I pulled out several years ago with your progression was the fact that with any dentistry consultation within the practice, they would call you in as the
Correct.
person that did dentistry. And that, I think that is a huge thing for practices in general, especially multi-doctor practices, to have one person, the person who's most talented, person that's got the most passion, to be that go-to person that literally comes in as the local specialist, not taking specialists out of context, obviously,
Right.
but you're the in-house person. You're the go-to person for dentistry who has the most knowledge. I would rather you talk to Dr. Bowden about this because she can put a different twist on it and give you more information.
Sure.
I can. And that's something that I would strongly suggest that our listeners take to heart. And certainly not all of our listeners are the decision maker in the practice. But if you're that person, if you're the most talented in dentistry and have the most passion for dentistry in your practice, you probably should be the only one doing dentistry in that practice.
Absolutely. I agree. And I think that helps for the staff too, to say, I heard Dr. Smith recommend dental cleaning and assessment for your patient. Let's schedule a consult with Dr. Bowden or whoever that person is. We did free 30-minute dental consults with me the first year that we started this expansion. And that sort of upfront commitment was a real sign to the owners that did have that passion for it. We believe in this so much that we are going to take 30 minutes out of our day, free of charge, whether you schedule or not, to talk about dentistry and why it's important and what we're learning with the addition of this equipment to our practice. That became the cornerstone for our success, was those free consults. And I guess that's why I still like talking to clients.
That's great. And I'd like to expound on that a little bit, just so people know how to get that started if they want to do something like that. Was that a marketing piece that you sent out to your existing clients? Was it just people who came in for annual exams? How did you get the word out to your clients that you were doing that?
It was mostly in-house. So if my colleague had a patient who she thought would benefit from dentistry, she would give some basic information and then recommend scheduling a free consult with me. If I wasn't tied up, I would come in at the same time, but I found it was more productive to actually have an allotted amount of time dedicated to that person. And when we got phone calls asking for quotes, what will it cost for us to get my cat's teeth cleaned? We had the front desk staff add very short script of, what are you looking for? We'd love for you to schedule a consult with Dr. Bowden. She's doing dentistry in our practice, and we'd love for you to come have a tour. And we gained a lot of clients that way. They were price shopping, but they came in, they had their consult, and we had about an 80% success rate, which is opposite of what we tend to expect, or what I led to be what I had experienced before we started this journey. And I think the passion was the difference, just the commitment to, and the confidence. You can't have the passion without the confidence or experience to lean on. And so I think that was crucial.
Excellent. And one more question on that topic. So that 80%, that included the people who were just calling for price shopping.
I probably don't have that data. That was definitely our in-house. If they scheduled a free consult with me, we had about an 80% scheduling rate. That was not our success rate across the board, because I don't know if I ever ran those numbers, how many declined to schedule a consult. But we went from doing something like, we were only doing one a week, and we increased that only by one number. We were doing 50 a year. We started doing 100 a year, but the revenue was exponentially greater than that, because of all of the pathology we found and the need for advanced surgical extractions. I think it would be hard for me to get you a concrete number. I remember from your seminar that we need to expect that 80% of the people are going to say no and not be discouraged by that. And that shift in perspective, just going in saying, yeah, she's probably going to say no, but I'm going to talk about it. I believe in it, and not to let that discourage you.
That's great. And that's certainly counter to everything that I've been exposed to. So I love that. And that's certainly encouraging to all the practices out there, especially if you've been exposed to my little spiel on that, that's pleasing to hear. I'm so glad to hear that. That's amazing.
We told the staff 80% of the people are going to say no, or they're going to balk at the price, because this is a complete restructuring of everything that they've come to know about dentistry. A $250 cleaning is not a full procedure. And so that shift probably took about 5 years, where clients were aware of what those differences were between just the scale and polish versus a full assessment. But letting the staff know not to get discouraged. We're going to talk about this regardless of who says yes or no, because this is right and we believe in it, and this is our passion. So.
Excellent. That's an excellent takeaway for everybody. Are there other things like that you could pass on as little pearls to people who are in general practice and they are doing dentistry at a pretty good level and could benefit from, that could be easily instituted?
I think having some of the support staff that may not routinely be involved in procedures, we would routinely have them come back and look at the before and after photos, or actually look at the patient on the table, compare it to the radiographs. And that was a real game changer for them too. They had discomfort discussing the difference in price on estimates. But then I think once they saw the real value of the service, they were much more likely to be comfortable going over estimates for 1 or 2 hours of surgery. So that helped. And that was probably the biggest thing, just the client education piece and making sure everyone on the team understood and had the same belief. And the proof is in the pudding. None of these dogs would come back for their rechecks, and they're completely different dogs. Old, slow, geriatric dogs are acting like puppies. And those were happy success stories as well. Owners considering euthanasia, and we do full mouth extractions and give this animal another 2-3 years of quality life. So it's a self-rewarding endeavor.
It's the big thing that keeps us all going, I think, is seeing that patient come back and be so different, and the owners being so happy that they have some extra time and quality time at that with their patients. And now, I'm sorry, go ahead.
No, go ahead.
Now I'm just looking forward, and now by you being in the position where you can help pass along some of those techniques to other practitioners, so that they can start on that journey that you started on and eventually get to the point, maybe not quite the heights that you've reached, but get to a point where they're doing dentistry at a very high quality level and they're providing that service. So it's a way to, what is the term? Pass it forward or give it forward?
Pay it forward. Exactly.
Pay it forward. Yeah, exactly.
A substantial portion of our caseload here at the dental clinic is surgical extractions. I don't do restorations. I don't do root canals. I don't do endo. I do some jaw fracture work. I do some cancer surgeries, but the bulk of what we do is surgical extractions. And that's why we're trying to train up the local providers, because a lot of that could be done at the general practice level with the right foundation and training.
Exactly. Excellent point. And we're the same exact way at the specialty level. We're probably 80% of our cases are surgical extractions.
Yeah. We have more work than we can handle. They thought bringing me on was going to slow things down. And unfortunately, if you build it, they will come, as the caseload has continued to skyrocket. So let's get more people in the program. We need help.
Would you say that is likely because of that same concept of going in the room and being thorough with an explanation to the owner? Whereas
I do. Yeah, with the exception of emergencies or follow-up care, we do 45-minute to 1 hour consults on all of our cases. And so we have that education opportunity. A lot of owners have concerns about advanced anesthesia. We get a lot of geriatrics with a lot of comorbidities. So we have that hour to go through all of that before we present them with any type of a treatment plan. And then that underscores the value of what they're getting when they schedule that appointment. And we're still scheduling 3 months out between the both of us. And there's days we can't find room for those urgent cases. It's challenging.
Yeah, I bet it is. But that's great. It's just such a great case in point of what can be done in general practice, and being able to provide that kind of value to your patients and your clients is totally doable. Again, with challenges, obviously, as the progression goes from the basics and knowing the basics and getting frustrated and breaking root tips, and just
every day.
A little encouragement for everybody out there. We still break root tips. I've been
every
doing
day
it for a long time. So don't let that get in your way. Don't let that frustrate you. That in quotation marks, failure is not actually a failure. It's just the reason to get better.
There are many days that I'm on my third root retrieval, and I'm just like, I appreciate the opportunity to learn. I appreciate trying to repeat that mantra so that I'm learning here. It's frustrating, but I'm learning.
That's an excellent takeaway for this interview, and just amazing to have you here. And I'm sure the people that are listening are getting a ton out of this. I would love to maybe have you back at some point.
Yes, I could have been more polished with the timeline, all of that, but this is the real me. So that's what you get.
Awesome. Trudi, thank you so much. And if there's anything that you can provide to the audience about how, if any pet parents are listening, how they can find your practice and find you personally to take care of their pets or their.
Sure. It's the Veterinary Dental Clinic of North Carolina, and we're in Durham.
Excellent. Thanks again, Trudi.
I sure appreciate it. Thanks, Ben. Brent. Bye-bye.
Take care. Bye-bye. I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at IVDI.org/INV.